Want to know what powers every step, kick, and lift of your leg? Let's explore the anterior compartment of thigh, the engine that drives your leg forward. The anterior compartment is the front part of your thigh. Its muscle mainly extend the knee and flex the hip. This compartment has quadriceps femoris muscle, sartorius, and iliopsoas muscle. Quadriceps femoris muscle. Quadri means four, so it is the collective name for four muscles. So first we have rectus femoris muscle. It has two heads, straight and reflected. Straight head originate from anterior inferior iliac spine, while reflected head originate from ilium just superior to acetabulum. All four quadriceps join to form the quadricep tendon, which inserts into patella and then continues as patellar ligament and finally insert on tibial tuberosity. Function of rectus femoris is as it grows hip and knee both joints, so it flexes the hip and extend the knee. Next, we have vastus lateralis muscle. So it originates from lateral side of femur. For example, from the greater trochanter of femur, from the lateral lip of linea aspera. And you know about its insertion that it's common that all four muscles insert on tibial tuberosity via the quadricep tendon. One more thing I want to tell that the function of quadriceps femoris muscle is to extend the knee. Either it is rectus femoris, vastus lateralis, vastus medialis, or vastus intermedius. The function is same, that is knee extension. Now we have vastus medialis muscle. So it originates from medial side of femur, from medial side of intertrochanteric line, medial lip of linea aspera, and medial supracondylar line. And you know about its insertion that all quadriceps insert on tibial tuberosity. This muscle, as like other, extend the leg at knee joint. Now we have vastus intermedius muscle. So this muscle is deep to rectus femoris, originate from anterior and lateral surface of femur, and it insert on tibial tuberosity, same insertion as all quadriceps. Function is again same, extend the leg at the knee joint. Quadricep muscles are innervated by femoral nerve and blood is also supplied by femoral artery. We have done quadriceps femoris muscle. So, in quadriceps femoris muscle, you know this is the collective name for four muscles. Rectus femoris, which has two heads, straight and reflected. Straight head originate from anterior inferior iliac spine and reflected originate from acetabulum groove. Vastus medialis originate from medial side of femur, vastus lateralis from lateral side, and vastus intermedius from the upper and lateral surfaces of femur. All four muscles join to form quadricep tendon, insert on patella, and via patellar ligament insert on tibial tuberosity. All are innervated by femoral nerve, and blood is supplied by femoral artery. Function of quadricep femoris muscle is to extend the leg at the knee joint. In addition, rectus femoris also flex the thigh at the hip joint. Sartorius muscle is the longest muscle of the body. It originates from anterior superior iliac spine and then moves vertically down and insert on medial side of tibia. With the insertion of sartorius, also gracilis and semitendinosus muscle insert on the medial side of tibia. Together, their insertion is known as pes and serinus because it looks like a goose foot. Sartorius muscle flex the thigh at the hip joint and flex the leg at the knee joint. Also, it helps us in sitting cross-legged. That's why this muscle is known as Taylor's muscle. Last muscle, iliopsoas muscle. This muscle is made of two muscles, psoas major and iliacus. So if I talk about their origination, so psoas major origin from lumbar vertebrae, while iliacus muscle origin from iliac fossa of pelvis. Both muscles attach to the lesser trochanter of the femur. Their function is that they flex the thigh at the hip joint. Iliopsoas muscle help us in walking, in running, in maintaining posture. Iliacus muscle is innervated by femoral nerve and psoas major muscle is innervated by lumbar plexus.